I'm a fellowship-trained breast surgical oncologist, and recently I presented this case of a young woman in her 30s. These are two MRI images demonstrating the same cancer just a few months apart. She could feel that the cancer was growing, and so she was telling her doctors no one was listening, and ultimately she found someone that would actually hear her and that got her in for another biopsy. Her first biopsy showed that she didn't have cancer. Her second biopsy showed that she did. Obviously, it was a very rapidly growing cancer. And I've gotten lots of comments and questions on that video since then. Is it really possible to have a breast cancer that can grow 5-10 times as large just in a matter of months? And the answer is yes. This is not my actual patient. None of the patients I present are, and all details get changed to protect my actual patient's privacy. However, I have seen actual patients with very rapidly growing cancers. The youngest patient I've seen with a cancer that progressed from her breast to her lymph nodes all over her body in a matter of weeks was actually only 18 years old. There are rare but rapidly growing cancers out there. A phylloides, like this commenter mentioned, can be one of them, but there are also breast cancers that can grow pretty quickly and can progress pretty quickly. And the moral of the story, really, for everyone is that it's hard for women to get heard by healthcare providers. So if you feel like you've got a lump in your breast, no one's taking it seriously, it's growing, trust your gut, find someone that's going to hear you. And that not only applies to masses in your breast, but that also applies to things like abnormal vaginal bleeding, abnormal abdominal pain, bloating, all these kinds of vague symptoms that often women are gaslit for talking about. Don't let any healthcare provider tell you that it's just anxiety without ordering imaging and figuring out for sure what is going on with you. No one's physical exam, not even mine, can accurately tell you that the symptoms that you're feeling are not from something serious. So please, trust your gut. In the last 12 days, we've seen government websites about things that impact women, like reproductive care, have just disappeared, and that they're rolling back access to women's health care on a federal level. So as we go forward with this new administration, it's even more important for women to listen to their bodies and to advocate for themselves.